Hello everyone, welcome to QAxon. So in this video, you will learn about the strength duration curve. Under this topic, I will first be discussing the interpretation of the strength duration curve. And then we shall look at some variations in this curve. So here we go. Now we know that excitability refers to the ability of a tissue to respond to a stimulus. But how do we measure this excitability? How do you know that one tissue is more excitable than another? So there are some measures of excitability that we define. It is common sense that if a tissue is highly excitable, then you only need a small strength of stimulus in order to elicit a response from this tissue. So in this context, the first measure of excitability is what we call as Rio base. So Rio base is defined as the minimum strength of current you require in order to elicit a response from a tissue. Now, not only is the strength of stimulus important, but the time duration for which you apply the stimulus is also equally important. So there are two time measures we define, chronaxy and utilization time. So if a tissue is highly excitable, then you have to apply the Rio base for only a short duration of time. So the minimum duration of time for which you apply the Rio base in order to elicit a response is called utilization time. However, in practice, this is a very small duration of time. Even the Rio base is a very small current strength. So we prefer applying twice the Rio base current because that is more practical. So we define another time measure, that is chronaxy, which is defined as the minimum duration for which you must apply twice the Rio base current in order to elicit a response. So in practice, we usually use the chronaxy as a measure of excitability. Now, all these measures of excitability can be plotted on a graph, and this graph is called the strength duration curve. Let's now study the strength duration curve. As you can see, the strength of stimulus is plotted on the y-axis. So this is in millivolt, and the time duration for which the stimulus is applied is plotted on the x-axis. So this is in milliseconds. So first we mark the Rio base. So we know that Rio base is the minimum strength of current required to elicit a response. So you can see that when you apply a current lesser than the Rio base, there is no response by the tissue. The graph begins here. So if you draw a parallel here, then this becomes the Rio base. Now, if you drop a perpendicular here, this time duration is the utilization time. So this is the time for which you must apply the Rio base in order to get a response. Now, how do you plot chronaxy? So you mark double the Rio base on the y-axis. So this is double the Rio base. So now from this point on the graph, you drop a perpendicular and this becomes the chronaxy. So on this graph, we have plotted all the measures of excitability. So how do we interpret shifts in the strength duration curve? Now let's look at this graph where this is the y-axis and this is the x-axis. So two strength duration curves have been recorded here, one from nerve B and one from nerve A. Now these are the chronaxy values. You can see that nerve B has a lesser chronaxy than nerve A, which means nerve B is more excitable than nerve A. So greater the excitability, more is the shift to the left. That means that as the excitability of the nerve goes on increasing, the chronaxy value goes on decreasing. So there is a progressive shift to the left. So shift to the left means increase in excitability, and shift to the right means decrease in excitability. So sometimes after a nerve injury, you may see a shift to the right, which is suggestive of a decrease in excitability. So this is how we interpret this curve in a clinical context. Therefore, strength duration curve is a useful test in the diagnosis of nerve injury. As I mentioned earlier, if the curve shifts to the right, then that means there is nerve injury. There is a decrease in the excitability of the nerve. With that, we come to the end of this session. Thank you.